What are you gonna bring with you? What are you gonna bring with you?
OB kit.
Okay. What else?
Right? OB kit. We're gonna have like oxygen.
Airway kit, BBM.
All of like the big heavy bags.
Everyone, the whole team.
Okay. And how are you gonna take the patient? Are you gonna put him on her back, on your piggyback, right? What are you gonna do?
A stretcher.
Stretcher. Okay. Or maybe
A stair chair just in case.
Yeah. Ideally, you want to get the stretcher if you could get it through the there's means to it, right? What else is important to bring? You're gonna bring a suction unit?
Baby carriage, like not the baby carriage, the car seat.
No.
Isolette?
No, not the
So,
we don't need that.
you guys don't have an isolette in your truck, right? And
Yeah.
it's a neonate. It's not big enough for the car seat just yet,
Yeah.
right? And it's not hasn't been born yet, so you don't know if it's going to be born yet.
Yeah.
So, what you do want to take is a suction unit, AED, in case, right, patient's going cardiac arrest. And you definitely want to take what protective equipment, such as face protection, eye protection, gowns.
Yeah.
Why? Because we talked about all the blood-borne pathogens, right? All right, so we take all this, you got your PPE, you're gonna come in, and let's say the husband opens the door, says, hey, it's my wife, right? She says her water broke, she has the urge to push, and what are you gonna do? What? You tell me. You walk in through the door, right? You see this lady?
Hi, ma'am. How are you doing?
Not so good.
How many weeks pregnant are you?
Oh, right away, 36.
You're 36 weeks pregnant. Okay, do you know what your due date is?
The doctor said this should be next week.
Next week?
Yeah.
Okay, so you're a little early.
So remember what we talked about? General. Remember what we talked about? First thing we come in is general impression. You're good. So what's your general impression first of all?
30-year-old female lying in a supine on her bed.
Anything else?
She's very pregnant.
Very good. Very pregnant. So the first thing I usually do is introduce myself, and I say, "So, what is your name?"
Brianna.
So, introduce yourself.
Hi, I'm Brianna.
Okay. Do you have an urge to push? Because we got to determine if there's imminent delivery. Right? If she says yes, and then you check for crowning. But let's say she says no.
Okay.
So then we go into our what? Mental status. Before, right? We gotta check mental status, and we gotta see the chief complaint.
So, when I just ask like what day is it, what time is it?
Sure.
What day is it?
Today is Wednesday.
Okay, do you know the President of the United States?
So I'm glad you went through that route, right? So don't go into the politics and don't ask that, right? And also don't ask the date. It's very specific. What you want to ask is their name, location, and the year. So remember, name, location, the year. Because I work night shifts. You ask me sometimes, what's the date? I'll tell you it's yesterday, right? It's not that I'm not alert. It's just, I haven't adjusted yet. Right? So, name, location, and the year. Okay.
Ma'am, what's your name?
Martha.
Okay. What's the day?
What's the year?
Oh, what's the year?
2022.
And what time of day is it?
Location.
Oh, what's the location?
My house. All right. And now we obtain what? The chief complaint. Yeah. So I called because my water broke and I have an urge to push.
Okay. Does she have an urge to push right now?
She says I may. So what do you want to do?
So I guess I would start preparing.
So we first check, right? You see crowning, right? So you'll say, ma'am, is it okay?
Ma'am,
Yes.
is it okay if I check for crowning
Yeah.
here?
You're already checking.
I see like a little head.
Yeah. We're gonna say there's no crowning yet.
Oh, okay.
Okay. So now we got the chief complaint. So now we do what? You can help each other out.
Oh, okay.
So you guys are a team. Work like a team. You guys are a team. So okay.
So airway, is it clear? Is it pain?
How would I-
Do I need
how
to
would-
suction?
how would I-
I will ask her to open her like mouth or swallow.
Okay. Let's say she does. That means what?
Has a
She
baby.
she does swallow. She's able to tell her name. She means that's what or what? And airway speed, right?
Yeah.
So now we're gonna check our
Breathing.
breathing. Go ahead.
So she's breathing rapidly.
Yeah. Can you ask her again? Is it okay to inspect? So you open her shirt.
Ma'am, is it okay if I can inspect
Yeah.
your chest?
Mhm.
So I just.
Yeah, you could open the shirt. I want to see what. Well, not like that, right? Imagine you're in the army.
Oh my
Open your shirt. So what is the goal of the
So should I
breathing?
take a blanket? Like,
So
okay.
Do I need to see her breast to see her breathing? Right?
I'm
So,
so for this.
what am I looking for, right? I'm looking for accessory muscle use, I'm looking for depth, and I want to listen to the, anyone has a stethoscope on them?
I do on my back.
Go ahead, grab it, right? So, we want to listen to the lung sounds. I'm not going to listen to the gallon, right? But I need to expose her breast to do that, right? What else? I want to look for accessory muscle use, right? I want to see the tidal volume. Is she, when I say tidal volume, I'm talking about, is she moving enough air with her ventilation, or is she barely breathing, like gasp, like just? Then maybe I need to assist her with some sort of therapy. And then what else you want to do? There's another thing,
Oh.
the pulse ox. So, James, can you show us, we put a pulse ox, there you go. All right.
She's got the opposite.
And you come, you're going to check the lung sounds, right?
Does she actually have lung sounds?
She does have lung sounds.
Oh.
She should.
Yeah. So now we got saturation. Is that better? Good.
Good.
Good. Okay. So ideally, I listen to mid-axillary. Why I listen to mid-axillary? Because I want to know bilateral lung sounds.
So
Right?
you don't do your clavicle and then?
I'll probably just do mid-axillary in the primary assessment.
So
Why?
like right
Because-
here, right?
Correct. Right under the armpits on both sides. Because I want to know if she's moving air and it's present on both sides. I'm not really like trying to get particular lung sounds per se. Right? So do we need to give her oxygen right now?
No.
Yeah, she looks like her saturation is good. She is breathing a little fast, right? But that could be because she has a gravid uterus pushing up on the diaphragm, so she has low amount, right, of expansion of the lungs. But saturation looks good. She's a little fast, right? But that's fine. Okay, what else? We
A
good?
little question.
Huh?
Would, in a pregnant woman, would they use accessory muscles in the stomach too?
So not necessarily on the stomach because of the gravid uterus.
Right.
Everything is pushed up, so their lungs don't have enough volume to expand, right? So the way they will compensate for that one is they make more blood volume, so more blood volume circulating, right? The other thing, they may breathe faster, right, to compensate for that, right? But now we're gonna check the next letter in AB.
Circulation.
Okay.
So CTC, like.
Diaphoretic. She has pink mucosa and she's dry. No, she's not dry. She is warm. Warm. She's diaphoretic and she has pink mucosa.
I mean, no one could do that.
Yeah, she's sweating.
She's sweating?
Yeah.
Well, because she's
Good to
like
go.
she's in birth, like she's in labor, so it
She
would
might
be
have
normal,
pain.
right?
She might have yeah. She might be in distress. Very good. Her sympathetic system is working.
Ask if you can check for hemorrhaging.
So good. Excellent. So go ahead. Yeah.
Ma'am, do you mind if I check to see if
Yeah,
there's
that's fine. Yeah, you notice how she doesn't pull off the entire gown. Right? Very good. Very good. Right. So hemorrhage, no hemorrhage, right?
No.
All right. What else? We got skin. We got bleeding.
Pulse.
Right. Go ahead.
Pulse?
Yes.
This one doesn't. If you come on this one, you will feel it.
You feel it?
Yeah, it is. It is there. Yeah, yeah. Yeah.
I don't feel anything.
I know it did before, but I couldn't feel it now.
Yeah. It seems to be like floppy on this side.
See where my fingers are?
Yeah.
Good. Exactly.
Okay.
So it's not on this side.
Don't feel it?
No.
Press inside.
No.
Still don't feel it?
Sorry, no. I'm a bad team lead. I don't feel it.
There's like the way it works, there's a groove, and when you like press it, it will activate it. It's okay, right? We're gonna say the pulse is present, there's no bleeding, right? And we got the skin. Anything else in circulation? So vital signs are not part of the primary assessment. We already got that. So if you're gonna do your A, B, C, D, E, right, what will be D? Disability, she is alert oriented times 3. GCS is 15. Exposure, we're already exposed, right? And environment, right? Can't control the house, but we're gonna move it to the ambulance, right? So now we make a decision. What will be your decision? Good. Let's say we moved her to the ambulance. We got an ambulance, right? We're inside the ambulance. What is the first thing you want to do? Huh?
Ask her what hospital insurance goes to.
What hospital she wants to go to?
The insurance car.
I wanna go where Beyonce delivered. I wanna go to Beyonce. I wanna go VIP.
Sample.
So you may, right? But ideally, right? You don't know what else is going on. Maybe you have complications. Then you may not want to ideally take her to the closest, right? So you would ask her where's your, if you've got prenatal care, if you have a doctor, which hospital is seeing you, right? That would be the best thing to do. If not, you want to look up which hospital offer obstetric care, right? Neonatal care, in case you have complications. But let's say you get to the ambulance, right? What are other things we're assessing for? What is the other components of the secondary assessment?
Sample. Sample.
Yes?
Your sample right now. Sample.
You guys can all, like, you guys are on a team. You guys can help each other. All of you can talk.
So ask us for symptoms.
I'm not feeling good now.
Ma'am, can you tell us what you're feeling right now?
Oh,
Like, having
I have pain. My water broke. I think I'm going to push. I have the urge to push. My contractions feel that are coming fast, and they're intensifying as they come.
So then we could like assign a person to track the contraction time.
So the best person to sign is who? The
mom.
mom, because you're not going to be able to feel her contractions, right? But if you turn on her phone, the stopwatch, and you say, listen, tell me how long, right? They come when they come, how long it takes when they come, and how long the duration of them, and do they intensify? So I'll say, okay, every 2 minutes, and they last, let's say, 30 seconds in duration, and they're strong, right? What else we want to ask?
Any allergies?
I have no allergies.
Do you take any medication?
The doctor said I have gestational hypertension, and he prescribed me something for my blood pressure, but I don't remember the name now since we left the house.
Do you have any past medical history?
I have history of asthma.
Okay. What was the last time?
Do we like ask like for the past medical history also like birth surgeries and
Have
stuff?
you had any complications?
I have no complications. This is actually this is going to be my third child. I have 2 other children. They're age 2 and 3, and they're with my mom.
Any abortions?
I have no abortions.
What type of delivery were your previous kids?
I had vaginal delivery in the hospital.
And you have 2 living kids? Right?
Yes, I do. Age 2 and 3, they're with my mom.
And you do?
Yeah, she says it's every 2 minutes and about 40 seconds. Yeah. Yeah. What else you could check again, right? What else you want to know? Okay, good. So what? Ask me what else would you like?
What's your pulse?
All right. Yeah. Oxygen is what you see on your monitor.
What are her respirations for you?
Respiration is 34.
Oh, okay, that's okay. What does that mean? Oh, high respirations?
Okay.
Oh my gosh, she has high blood pressure. That blood pressure
This is
is
your blood pressure.
high.
I had someone the other day that was at 200.
Well, it
I have
depends.
someone. I mean, he has diabetes.
What are we
so
worried about with a blood pressure like this?
too high.
Hemorrhage?
No, hemorrhage would be low blood pressure.
Oh, red light.
Have you guys heard about preeclampsia?
Yeah.
So what are the signs and symptoms of preeclampsia? What are some of the things you may see?
High blood pressure.
Hypertension. What else? Well, before they seize, right? Preeclampsia is before the seizure, so you may see like pedal edema, right? Sacral edema, right? They may complain of abdominal discomfort. They may have photophobia, right? They may have a headache, right? Some of the things that you want to be cognizant about. So you want to assess for those things, right? If she's having. You want to call ALS if you haven't done so already, right? Because she may go and start seizing, right? So you want to be cognizant of that, right? So you see she's seizing. What are you gonna do on the EMT level, on the BLS
Up
level?
to the recovery position and wait for the seizure to begin.
Yeah, and you wanna see, right, if I had a non-rebreather mask, I would put a non-rebreather mask on them. You wanna make sure that you protect her from the environment, right? Ideally, paramedics are gonna come if they have, on time, right? Yeah, this is why we're gonna put oxygen on her, right? And paramedics come, they're gonna give her a drug called magnesium sulfate, right? Hopefully, it breaks the seizure. The ultimate treatment, anyone know what's the ultimate treatment for eclampsia? It's the delivery of the fetus. Delivery of the fetus, right? But you guys cannot do any cesarean section, right? Anything like that. So, if this happened to you and the ALS was extended, you would call notification, right? Give her oxygen, protect her from the environment, and you rush them to the hospital. You're gonna tell them, right, a female 30-year-old, right, who is in active labor, who will start to having, so this is no longer pre-eclampsia, this is eclampsia, this is seizure, right? So we're gonna say for this case, she wasn't seizing, right? And she tells you, right, so you've got the sample history, right? You've done those questions. And there's also focused physical exam, but before you even do it, she says, okay, I have an urge to push. So you say, okay, let me take a look and let's get all your equipment set up. So what do you guys need?
You can read it closer.
Oh, yeah.
Okay, ready? She's about to push.
You need someone.
You're gonna put your hand right over the premium and the hand is gonna come explosive. Yeah, go ahead.
Okay.
She says, oh, I think I'm pushing. One,
She
two,
is
three.
pushing.
And the hand
Ready,
comes
be
out, right?
ready.
So protect the hand. Okay, there you go, right? We first check what the neck for. Right? All right, let's see. There's some fluid, right? How we suction, right? All right, it's clear, right? We assist the opening of what? Of the. Yeah, assist with the delivery. And the first thing that you use, the shoulder is going to come out. You're basically guiding the head down, right? It's going to come down like this. You check the neck for the nuchal cord. If there was one, you try to slip it over. If you can, you'll cut and clamp, right? And we're going to say you're assisting with the delivery, right? And the fetus comes out, emerges, right? What are you going to do?
You're gonna dry it?
All right, so go ahead, assist each other. And we're gonna get the, what? The clamps?
The clamps are going
And at this time, right, I'm monitoring the baby, right? I'm not just drying, I'm stimulating. I'm rubbing the soles, right? I'm gonna rub the back. I'm gonna put my stethoscope on the heart to get the blood pressure, to get the heart rate, I should say. And then, what else?
Does it actually have a heart rate?
This one does not. Then I also put my pulse ox around the arm or the leg, right? So we'll cut the cord. We're gonna say the cord is cut. I'm just gonna take out the placenta because we're gonna pretend this has been cut, right? So what do you want to do now? What are you gonna tell them all? How would you?
First check the placenta.
No, the placenta has not been delivered. We're gonna pretend the placenta is
I'm so
inside.
sorry. Okay.
It's just I cannot cut this cord, so we have to.
Yeah.
Right, but before we give it to the mom, we gotta make sure the baby doesn't need resuscitation.
So we
How-
have
how-
to check the brain.
Yes, what else?
And then we put the
Pulse ox, and I want to get his respiratory rate, I want to get the heart rate, and the pulse ox. First minute, what's the pulse ox?
60 to 60.
Should I start positive pressure ventilation? Should I start?
It's 60?
It's fine, right? It's fine, right? So I'm looking for respiratory rate. I'm looking, if the baby's vigorous, I'm looking for the heart rate. If my heart rate is like 180, my respiratory rate is 60, baby's prime, vigorous, right? It's not limp, right? I'm going to then say, okay, mom, you got a beautiful baby boy. The birth time is 2/26. The date is 8/18. That's the birth date, and you're gonna give the baby to the mom. You're gonna say, we're gonna give you the baby. We're gonna put it skin to skin to keep it warm, and we would like you to nurse, right? Why? Because we want the right and oxytocin. Well, that's what you want, but what you're gonna tell the mom. It's also important for the bonding, right? And it's important, right, for you to have the skin.
There's a headpiece. There's a headpiece.
In the corner, like a cake.
Thank you.
Alright, so we got a pulse ox on the baby. We're gonna say baby's heart rate is 180, right? What is it that we want to check now? What is important to check?
The mother.
Full set of vital signs for the mom, and we were looking for possible bleeding in the postpartum. Postpartum hemorrhage is a killer for the moms. Postpartum hemorrhage. You bring a patient like this who's heavily bleeding in the hospital, we basically start like blood transfusions, massive blood transfusion protocol. So always check for bleeding, right? So I'm checking for bleeding. I'm doing vital signs, right? Look at the vital signs. Did the blood pressure decrease?
Yeah.
Yeah. Is that good or bad? That's fine. What are pulse signs? Is there anything abnormal?
No.
Respirations is high, right? Respirations is high. Yeah, but it's fine. You have sympathetic release, right? She just delivered. She's breastfeeding, right? And this is definitely going to be stressful for her, right? We definitely increased the heat in the ambulance, right? And we are notified the hospital that we are bringing. So what are you checking for now? What are we looking for in route to the hospital?
Do we see the placenta came out yet?
Say louder.
Do we check if the placenta came out yet?
Yes, very good. So placenta is going to come out 25 minutes, maybe 30 minutes. Sometimes you may not get the placenta delivered. What you're usually going to see is, like, first the port is going to extend, and then the placenta will deliver, right? You're going to put it in maybe a red biohazard bag, but always label with the mom's name so that they don't toss it in the biohazard container, right? So always put it the names of the person, right? So they'll say placenta hasn't been delivered, so we check for that. We check for bleeding. What else is very, very important during transport to be assessing for?
APGAR.
What are we assessing en route to the hospital? Very important things.
The baby's APGAR.
Vitals. What else? Mental status of the mom, because if the blood, right, if she's bleeding, she's gonna have, right, mental status is gonna go. So full set of vital signs, mental status. You're gonna be assessing your ABCs, right? You're gonna be doing your focused physical exam, right? And then I'm gonna give you guys a few minutes, right? We're gonna say you gave a notification. You're gonna imagine this: you are rolling in through the hospital, and the team, right? Let's say the OB and neonatology came down. They have the isolate. They want your full report, what happened, everything, right? And then she took some good notes, so you can talk to each other for like a couple of minutes, and then give me the full report. So I'll give you a few minutes to gather your thoughts. So I don't want like some pieces. I want like a coherent report.
So we could say 30-year-old female, she's 36 weeks pregnant. Her due date was supposed to be next week. We found her a super position. She wasn't in pain. Her DCS was 15.
We could reset, right?
Yeah.
She did have a seizure, but she wasn't.
She had preeclampsia followed by a seizure secondary to. You are amazing.
Yeah, this is really good.
Okay, so let's run it through. So, female found this one in her bag. At 26 weeks pregnant, successful fetus, she's later transmitted to 15, pregnant, She had preeclampsia followed by a seizure.
Her vitals are
We gave her
sick
O2
now.
via non-repeater mass, and then she delivered on route.
So we have to do the placenta.
Oh, yeah, and the placenta, she had to deliver all that too.
Oh, which one?
She has gestational hypertension, and then we took over Right.
Delivery. What's the G and G code?
Say it again.
the G and G code.
It's gravid. How many times her belly was basically? How many times she was pregnant? How many times she was pregnant? P is Perry. How many like full-term deliveries you got?
How many pregnancies? Is there a pregnancy? How many carrying full term? Five. Third child. How many pregnancies in 3 years unless she had?
So we change it after the delivery?
Oh yeah. This is once you get to the hospital, right?
Right.
In what instance will you have 2 over here and 3 over here? Remember, this is 3 pregnancies, right? So in what instances will you have 2 pregnancies and 3 live births?
One died.
Twins, right? Go back to the This was a good story, right? He's not gonna sign your PCR and stuff. Well, how many PCRs are you making over here? 1 or 2?
Two.
2, right? So he's not gonna sign none of those PCRs until you give him a good report. Then give a good report.
All right, so you guys come in, right? You're all in with your stretcher, and who's gonna give you the report?
So we found our patient, she was sitting in a supine position, she's 30 years old. Her birth was supposed to be next week, but she's 36 weeks pregnant now.
She's ANO times 3.
Okay.
She's had 3 previous pregnancies,
Good.
3 full-term deliveries, 0 abortions, and with this child, she has 3 living children.
Excellent.
En route to the hospital, she was preeclampsia and did have a seizure. Yeah, preeclampsia and she did have a seizure.
We gave her O2 via non-greater mass.
Okay, I would say that stuff is not as important to say. So in the beginning, you'll say, all right, we're bringing you a 30-year-old female who's 36 weeks gestation, who is gravida 3, para 3, abortion 0, and live live children is 3, right? Who has past medical history
Oh, gestation.
of diagnosed gestational hypertension and asthma, right? Who was prescribed medications, but she does not recall the name for the hypertension. Upon our assessment, our physical exam showed that she has pedal edema, sacral edema. She was complaining, let's say, of a headache, and we saw that she went into eclampsia during transport, and she had a seizure that lasted X amount of minutes, right? And you could say ALS arrived, they terminated it with the medication, right? So you want to say that upon delivery, right? You had a fetus delivery. Were there any complications? Did you have to do CPR or anything like that? No. So you could say then, if there's no complications, say we had basically a full term, right? And what was the Apgar score? 1 minute? So we haven't done the Apgar score. What about 5 minutes?
Like 7 or 8.
So if the baby's vigorous, baby's crying, was a good heart rate, right? Again, probably a 9 on that, right? So probably a 9, right? So you want to give them the Apgar score, right? You also want to say, right, prior to the delivery, what were her vital signs? Prior to the delivery.
She was hypertensive.
So don't say hypertensive, you actually give the numbers.
188 over 7.
Right? So you want to give exact numbers of her vital signs, right? And then we had a delivery, and then her vital signs were, right? What else is important to know? Upon our assessment, there was no postpartum hemorrhage, or there was, right? Did the placenta deliver? No. So placenta delivered. So we arrived here, placenta is still right in the uterus. It hasn't been delivered. So we bring in the fetus, but the placenta is still there. We assess there's no postpartum hemorrhage. You also want to say, right, if you assess where you clamp the port, there was no bleeding from the port, right? In case, or it was bleeding, you had to reinforce it to put a secondary clamp, right? You want to inform that. And then you will say, right, the baby was given to mom for nursing, right, skin to skin contact, right? Those are the major things that you want to tell them, right? You guys have any questions about anything? How do you guys feel you did? I think once you got together and started like talking to each other, I think it looked better than as being one person. So like when you practice and you're going, like, work as a team. Don't just be like one person who's doing everything. If you see somebody is having, like, they're not sure, but you know what to do, say, hey, how about we try this, right? Or have you thought about this, right? So give them an idea, right, to do it. And then we're gonna go again, right? We're gonna get a new case, maybe a little bit more complicated. So have a new team leader, right? How about one of you guys who hasn't gone? And then you can assign roles, and then you're gonna record everything.